Hi, I'm Lily. I'm an international board-certified lactation consultant, specializing in tongue tie and in subfunctional tongue. I'm very happy to be speaking today with Mrs. Joy Moeller about tongue training. Mrs. Moeller is a registered dental hygienist and is a former associate professor at the Indiana University School of Dentistry. Mrs. Moeller has been practicing orofacial myofunctional therapy for about 40 years now. A lecturer who educated generations and still teaches myofunctional therapy around the globe at venues such as USC, UCSD, NYU, Columbia University, University of Sydney, Australia, universities in Germany, Belgium, and so many more. Mrs. Moeller's clinics are in California, her home state. As a leading myofunctional therapist, Mrs. Moeller is always working with patients of literally all ages, from babies to adults, patients who suffer from mouth functional issues. Many of her patients have tongue functioning issues, or as we call it, a subfunctional tongue. Thank you so much, Mrs. Moeller, for speaking with us today.
Oh, you're welcome. Glad to be here.
Mrs. Moeller, why is it that performing tongue exercises is such an essential part of the comprehensive tongue tie treatment plan?
Well, it's really important to both prepare the tissue for the release in order to get a profound release, so that you don't have to keep doing, a second release, third release, fourth release. We call them revisions. But it's also important after to maintain that tight tissue, that things are going to work well and restore the proper function of the tongue. And the muscles, a lot of people don't understand, there's actually 16 muscles inside your tongue, and they all have different functions. So by having that restricted tissue in there, all those muscles need to be retrained or repatterned.
Before you knew of the Lipo device, how did you advise your clients to do the tongue elevation exercises?
It was a lot more difficult. I would teach them to have very clean fingers. I would even give the children gloves to put on and go in with 2 thumbs and push straight in and up. And that was difficult, especially if the parent had to do it. The child had to put their head on the parent's lap, and then the parent would get in there, and sometimes they would try to rupture it themselves and stretch it out because they thought that would be better. But it was nasty. It was a nasty problem.
And in what ways do you feel the Lipo device helps them in performing these exercises?
Because the little Lipo thing, they can just go right in and pull up, and it's more comfortable, it's rounded, you're not dealing with people's nails and dirty fingers, especially with our viruses now. So it's much more aseptic, and it's soft and it's rounded at the edge. So it's easy to just put it on your finger for the parent to do, or the child. And it's just made it much more comfortable and much more profound as far as the release, the pre-release goes. So it's a stretch. What it's doing is stretching the tissue so that the doctor, whoever does the release, will have an easier time.
So you feel that they're more receptive and they do it more than they would do it if they didn't have it?
Oh yeah, definitely. People have a real aversion to putting fingers in their mouth. That's why, as a dental hygienist, we would try to get them to floss, and they would go, oh, they wouldn't want to put their fingers in their mouth, and much less a baby, so there's this big aversion to doing that. And so with this, it makes it easier.
And what about these people that you see that you obviously feel that they have a subfunctional tongue, but you don't feel that the reason is the string, so-called, under the tongue? Let's say you feel it's something completely different, like maybe from a neurological background, or do you recommend tongue exercising for these people as well?
Absolutely. It's like, which came first, the chicken or the egg? And I work real closely with osteopathy, different osteopathic positions, or cranial, sacral kinds of movements, chiropractors that do cranial work. And, if there's torticollis or other kinds of neurologic problems going on, to get the tongue functioning will assist the nerves. It's putting pressure on the right nerves in the mouth if those 16 muscles are functioning properly.
So it's not only these cases that are going for a release that really need to do this work. And from your vast experience, what could be a result of not doing exercises in such cases?
There's so many problems. Like I told you earlier about the gentleman that had repeated jaw surgeries, orthodontic problems, headaches, TM joint issues, periodontal disease, mouth breathing issues. I see patients that have head and neck posture problems because their tongue is down all the time. Digestive problems from swallowing air incorrectly and gagging on things.
Such an important way of preventing all of these quite...
Oh, yeah. I mean, even relationships are different because if their tongue is not functioning right, a lot of times they develop periodontal problems, and then they have bad breath, and then they don't want to kiss each other, and it's just it goes on and on. Emotional problems.
Snowball.
It snowballs. Mm-hmm.
And what about these people who do, or persons who do have a release and then they don't do the exercises?
Oh, a lot of times it's worse because what happens is scar tissue develops. And so then the tongue, I've actually had patients who had major speech problems, and even the speech pathologist would refer them to me for myofunctional problems. But I've had several patients whose tongues were actually tied to the floor so bad that even the surgeon wouldn't do another revision on them, because it's just like the tongue is part of the floor of the mouth. And even the oral surgeon that I normally work with said, I can't do anything with that patient.
How would you advise such a patient to self-exercise with the Lipo device?
To just do gently, go in slightly and go in more and more. And then I would work on working with the lips, making sure the lips are not tethered and that they're functioning. I would have them blowing. I mean, there's over 100 different exercises that I do, but this would be one of them to assist.
Do you have...
People don't like to put their fingers in their mouth.
Yeah, so that's a very good bypass for them.
Yeah, I teach them, I even use gloves sometimes, and I give them gloves to take home so that I want their cheeks massaged and all the mucosal tissue in their lips and the floor of their mouth massaged, and even the palate, the soft palate, hard palate. But this is a good way to get things started.
Yeah. And do you have like a protocol that you recommend? For instance, if I have a child who's been tongue released, how many times per day would you recommend that they do it, or for how long after the surgery?
Well, I have a protocol. It's very sequential. I start with the tip of the tongue, the sides, the middle, the back of the tongue. I work on breathing, chewing, and swallowing, depending on the age of the child. I think getting the masseter muscles, temporalis muscles working. I would see him weekly for the intensive part, which is like 8 weeks. And I would give him, I'll show you, I give him like a protocol, starting with certain exercises. And every week they would do the exercises, and the days of the week are here, depending on the age of the child. of course.
How often do you feel they should do tongue elevations after tongue release?
I have my patients 3 times a day do exercises for at least 10 minutes, 15 minutes. I have them do all different kinds of things, you know, where they make the pops.
Yeah, the pops, the cave.
The caves and different things where they hold things up there.
And using the Lipo device, how many times they should do the elevation exercises?
Yeah, if they can do it 10 times, 3 times a day, at least for the first few weeks after.
10 repetitions of the movement, 3 times a day okay, yeah.
For at least a few weeks to make sure that it doesn't reattach, because you want to keep the tongue mobile. And you could play games too with the children. Yeah. Once their tongue doesn't hurt anymore, they can move it.
Yeah, definitely.
Okay. But once it's that initial healing has taken place, then you don't need to use as many props. You know, you can do it with us.
Yeah. Great, super. Thank you so much for speaking with us today, Mrs. Moeller. It's been a real pleasure.